Right. We'll give people a minute or two just to. All righty. Hello, everybody, and good afternoon. Thank you for joining us today. I want to thank both Senator Jil Tracy and Representative Norine Hammond for joining us this afternoon to give us an update and answer any questions that you may have. In the interest of time, I'm going to make this short and sweet, and I'm just going to hand it right over. And how about we start with Jill, and then we'll give Norine a chance to talk.
Well, good afternoon and happy Friday, everyone. And I'm really happy to see your census poster, Lauren, behind you, because I was on a census webinar this morning, and Illinois is doing really well, and we're still encouraging everybody to make sure everybody gets their census forms filled out. So that's a high priority every day going throughout this end of the year. Since we last spoke, certainly a lot of changes. Some things have remained the same, but we've had a lot of information out about the federal funding, the state grants. Recently, the state announced some broadband grants, which I think is very good for our rural areas to expand broadband. And certainly with the pandemic that we've experienced with online learning and more people working from home, we know that's highlighted how important access to quality broadband is. And so I'm encouraged that the money that is being awarded is going to go to the places where it's needed most. And there's a lot of private investment from private companies in this. And so I see that as a good thing as well. We continue to learn more about what we call the local cure funds. There was quite a bit of discussion last week from the Municipal League that helps with local government representation, that they were concerned about how the cure funds were going to be distributed. It wasn't quite as fairly apportioned as we would have liked. And in fact, we learned that downstate is perhaps getting shorted on some of that was supposed to be going more downstate. So that's a continuing story. We're going to be following it more and working to make sure that those funds go to the local governments. And then most importantly, they go to the businesses who need them to keep operating. And I know that's of concern to everyone. So that's an ongoing thing. We had the governor announce new regions this week, and that was encouraging because we were in a very big region previously. Now those regions have been broken down into about 11, and Macomb will be in with Fulton County, Mason County, some of the others. But I see that as a good thing. We had some metrics placed, and I'm hoping that we can keep our positivity rates and our hospital capacity under those metrics and be allowed to keep operating as we are, and everybody keeps staying healthy as much as possible. And so that's pretty much an update of what I've been working on here recently. So I'll turn it over to my colleague Norine, who's been working with me on many of these issues.
Thank you. Thank you, Jill, and thank you all. Appreciate being with you this afternoon, and certainly appreciate everyone taking the time to chat with us for a little while. Just to touch base on a few things that are going on, the frustration, I think, with a lot of individuals and certainly a lot of legislators is the inability to meet in person. These Zooms are great. They can't take the place of in-person meetings, but our session, as you know, was cut very, very short. The Senate we met for 3 days. And our business basically dealt with anything that was COVID related. The Senate was able to meet in the Capitol with some challenges, but they were able to do that. The House, however, we met at the Bank of Springfield Center. So we were, because of our numbers, we were spread out across that area there. And it was an interesting 3 days, but at at the end of the day, I think for the most part, everyone came out of it healthy. And so that was certainly most important. Touching base a little bit on what when Jill was talking about the regions, I think the most encouraging part of the redo for the regions as it affects us in West Central Illinois is the fact that Chicago and Cook is now their own region. And so they've got their own people to take care of, but how their numbers go will not affect those certainly in the western suburbs and other areas. So I think that's really important. Ironically, when I looked at the numbers a little bit earlier today, they have some of the lowest numbers compared to our region and the region that Adams County is in. So that's a little irony for us all, how that is going out. But I think as we continue forward, we'll see more and more how the COVID-19 dollars are distributed. And I would hope that certainly if you have issues that you let us know, and we need to hear from you. The biggest challenge we're facing now for you as parents, as educators, as administrators, is what is the school year going to look like moving forward. I know we have guidelines that have been put forth. At this point in time, though, it's a day-to-day ongoing issue, and I think we'll have a lot of bridges to cross before we get to the point where the schools are opening at any level, be it K through 12 or higher education as well. So it's going to be a challenge. I would ask that people be patient and kind, because there are opinions on both sides of the issue, and as I often say, there are 18 sides to every story. So we just need to do the best that we can. So I'll kind of let it sit there, and Lauren, if you've got questions for us, we're happy to do that.
All right, well, thank you so much for the update. Before I start reading the questions that were submitted to me ahead of time, I do encourage anyone that does have a question to please submit one through chat, and I am happy to read those. Otherwise, I'm going to start first with the ones that were emailed to us ahead of time. The first question, I would be interested in knowing if there's any legislation proposed for employers to be flexible with the employees to work remotely with kids in school that doesn't involve employees being forced to use vacation or earn time. If there's anything being proposed with that assist in payment for childcare or schooling for the children the 3 days they are able to participate in remote learning.
I certainly don't know of any such legislation that's been filed. The actual filing date for new legislation for next year is November 30th. And that's the first date you can file new legislation. So I think we've seen employers be extremely lenient in working with employees as far as crafting their working at home and their work hours. I think we've learned a lot throughout this whole thing of how much one can do working from afar, from actually in the office. And then, as we know, some employees just have to be on the ground working by the nature of whatever their work duties are. So I've, as Norine said, it's going to be a real challenge seeing what this school year is going to look like. And we've been working with daycare providers who are very concerned about having decreased numbers and then having to have extra staff, and then their bottom line just doesn't work that way. They are having a hard time having less children to care for, but having to have additional staff and that kind of thing. So we've been trying to work through some of those issues, and it's evolving. I was on a call last week going over childcare regulations, And they, by admission, really don't know what the final guidelines are going to be. And that's hard to plan. So I think we'll continue to see employers do what they can to be able to operate, but still keep their employees and recognize their issues with childcare, their issues with school. But, you know, as far as with private employers, I mean, there's really little we can do to make, by law, them do certain things.
I would agree with what Jill is saying. You know, there at this point in time, legislation would not be effective, if you will, because we're not in session. We are in for a few days in November, and but that's strictly for veto session. So that would be issues related to any vetoes the governor may have taken. New legislation would have to come with the spring session in January, and by that point in time, who knows where all of this lies at that point. But I would hope that, you know, as Jill mentioned, a private employer, we would have no jurisdiction over private employers. I would hope that they would be willing to work something out with their employees, assuming they're parents themselves and facing a lot of the same issues that their employees will be facing. I don't know, as far as school boards, they would certainly be the ones setting policy for school employees. And if John Meixner or somebody is on the call that could clarify that even further, I believe that would be something that the school boards would take up the policies in those situations, but not clear. But as far as legislation, no, there is no legislation right now. And quite frankly, while we have asked the speaker for some continuing session days during this time, those calls have gone unanswered to this point.
I might add on the school issue, originally when the guidelines were announced on reopening the schools in the fall, the messages I was hearing from the governor's office and from ISB, who oversees school districts, was that they were going to allow a lot of local control. Much like initially with daycare givers, many of them were concerned about the masks, and it seemed like they were going to be able to use their discretion depending on the age of the child, the nature of the child, his specifics of behavior, that type of thing. Now, we've seen a turnaround. I mean, just yesterday, unbeknownst to any of us, the governor's office has filed suit saying that the masks will be enforced in the schools, where initially we were told local control would be. And so, you know, we'll try to give you the best update that we have, but it is definitely changing day by day. And it's hard for us to follow it too. So we feel your frustration, because every day it seems like we learn something new, just with unemployment insurance, which has taken up so much of our time with people applying for benefits, and the independent workers who normally don't get unemployment, and the gig workers is another category that don't normally get unemployment. We've just seen a total fiasco with the unemployment system, and we've tried to help people. Their names have been put on lists, and then just last week we had a big turnaround that, no, don't give us any more lists. Here's a number you give out where they have to call. We hear again, nobody answers that phone. So it's extremely frustrating, but we're continuing to work on these things daily. We do. We try to address them and offer solutions and keep working for better solutions in these areas.
All right, thank you. Similar to that, we just had somebody ask if there's any legislation pending with regards to giving those who provide out of school, like the out of school providers funding.
Again, Lauren, I'll say there's no legislation pending. This is an issue that I keep bringing up to folks at the governor's office, that to impress upon them that I'm fairly confident that some of this CARES money or the CURES money, some level of that could certainly be used to incentivize or help our daycare providers, because they are going to be literally, they're going to be on the front line with this. If kids are going back to school, but they're not going back 5 days a week, then the parents, I mean, are they going to have to make a decision? Are we going to stay home with our children or child, and or are we going to be able to send them to some daycare? And yet, if they can't afford that, then there has to be some incentive to help them with that. So I would like to hear from the governor's office that, in fact, that is the case, but as yet, I'm not hearing that.
All right, thank you. All right, our next question comes from a restaurant owner in town, and they would like to know, it would help me due to the nature of my perishable business, since I lost a few grand on inventory in March, to either catch wind from the governor's office on closing restaurants again. A little bit better of a heads up would be appreciated.
And I think that the new announcement of the regions is helpful to answer that question. And then the new metrics, I think we can see that we're still below those metrics, and hopefully we'll keep below those. And that will give you some predictability, but certainly it's kind of nerve-wracking right now to see a spike in the numbers, especially downstate. And so it's just something that we as the public are asking everybody to participate in the masks, and it's a small discomfort for being probably one of the more proven ways to stop the spread.
And I was trying to think back because last March was 4 years ago, I'm sure. But I think that we had less than a week, if I'm not mistaken. We had less than a week's notice, or just about a week, if that. But so with the new guidelines, there has to be a significant uptick for 7 days. So if we're watching that, that'll give us a little bit of a window. But in addition, I think having some insight into, if we hit that metric, then how much time do we have? And giving our businesses, certainly our restaurants and our independent stores, that heads up as well, I think is terribly important.
All right, and the next part of her question, that she's been thankful for the grants that are out there, but wishes there was one for people who have a proven track record of running a business and not just my gender.
Well, and the grants that the local governments have kind of subsidized or overseen, the businesses that applied did have to prove a good track record. So I think we'll see that continuing, that the ones that are receiving the grants have a proven track record, have a good business plan in place. And, so I think those that have that will be rewarded. Now, it's kind of unfortunate for new businesses that maybe don't have a length of time to prove themselves that way. But that's why I think these grants going out to the businesses from the municipalities will be very important.
And I would also like to see, the governor's been pretty tight with releasing much money to directly to the communities, and I would like to see more of that. First of all, because I think the communities are painfully aware of what their needs are at this time, and giving them the local control, I think, over those dollars is more prudent than having it perhaps go through DCEO. There were a number, and I'm not privy to things in McDonough County concerning this, but I am privy to other counties where businesses had applied for funding through DCEO and were not successful, and I'm flabbergasted that they were not. So I think putting some of those dollars in the hands of the counties themselves, the municipalities, more of those dollars in that area would be helpful.
I agree.
All right, thank you. Our third question is, what are you doing to ensure we in Illinois will have accurate COVID-19 data now that the administration has forced hospitals to stop reporting to the CDC and switch to a private company contracted by the DHHS?
You know, we just learned of that. And, you know, I mentioned how things are evolving all the time, and we face these changes. That is worrisome. We want to have the best data. So again, I guess we'll be looking to your healthcare people to let us know what they're seeing, because that's how we've discovered this was even a change. So it's concerning. We want the best data. It's imperative we do. So we will be addressing that with the governor's office if we see. First of all, I didn't even know that it was not working. Was it not working for hospitals to report directly to CDC? Why did we change it? We don't know. And so that is a good issue to bring up with the governor's office.
What I see, particularly in our local area, is the reports that we get from the health departments, I think, are extremely helpful to us, and I think to all of the residents, that having those reports come through on a regular basis with numbers is helpful. We also can get that from IDPH as well.
All right, thank you. Our next couple questions are actually from MDH, so they might be able to touch on that a little bit too. I've decided to let them speak because I feel like I would have lost something in translation with what they want to talk about. So I'm going to hand it over to Adrian McGregor, and he's going to ask a couple questions, okay? You there, Adrian? All right, well, he was supposed to be in here. I just emailed him a minute ago. Is anyone else from MDH available to speak at the moment? Otherwise, I can go to the next question until Adrian's in the room.
Can you hear me okay?
Adrian's there.
There he is.
There, sorry guys. A little bit of Zoom fatigue, I think. I just want to thank Lauren, thanks for having us. Thank you, Senator Tracy, Representative Hammond. You've been an ongoing support of our organization during COVID. We just very much thank you for your support. We had two things. One, we have, in a very quick fashion, we pivoted a lot of our outpatient activity as we deal with COVID starting back in March. We stood up a telehealth initiative, and I want to thank both of you for your support in working through the process to ensure that we continue to receive effective reimbursement for patients using telehealth with Medicaid coverage. But I would appreciate continued support for private insurance. We took about, we're still hovering at about a 20 to 30% decrease overall volume year to date, and some softening of that volume allowed patients to use telehealth, needing outpatient care, needing to check in with their doctors to help maybe mitigate several critical health issues. However, we need support from private insurance to help reimburse in parity for those services. So appreciate your support in trying to help us work through that issue. I don't think COVID's going to go away anytime soon, and we will continue to utilize telehealth services for some time yet. So that was our request number one. Request number two is more broad, with the nurse staffing ratio legislation always kind of hovering out there. Again, we feel pretty strongly that appropriate nursing ratios in community hospitals like ours continue to be made at the local level by nurse executives, physicians, nursing managers versus somewhere else. And we continue to appreciate your support for allowing those decisions to be made at a local level. And those are the two things that we had today.
So Adrian, let me start with the telehealth issue. So am I do you have some private insurance companies that are participating and others that are not, or across the board, privates are not?
There's limited reimbursement out there for private insurance, but on par across the board, it's still not being recognized. And much of what we're seeing is reticence and hesitancy of people to come back on a healthcare campus, but interest and increased use of telehealth. So anything we can do to encourage this technology. Of course, hospitals like us have bore expense in trying to get this up and going for patients. We think it would be reasonable if we could have solid, strong parity of reimbursement for those services across private payers.
So at this point, the state Medicaid program is participating, is that correct?
Yeah, it is. Actually, we got an extension through the governor's declaration, an extension for additional reimbursement for another 12 months following when that emergency declaration is canceled.
Okay. And trust me, I hear you on the nurse staffing ratio, and with this COVID, I just look for that situation to be more and more challenging. I have a number of long-term care facilities that are really struggling.
Yeah.
And
Thank you.
it's an issue that's not going to go away.
I'm glad, Adrian, that you brought up about the private insurance. I mean, certainly, as you say, initially to get your telehealth system set up is more costly for you, but I don't understand why a private insurance company would stall with trying to reimburse you accurately because you're still having your staff's time tied up with visiting with a patient, the same amount of time. And so that is troubling for me, and I'm glad you let us know that. And then, of course, on the nurse staffing thing, unfortunately, that thing has reared its head forever. And I do think it's going to rear it again. I think, the strike that we saw recently in Chicago, or was it Joliet? It was some of the, maybe 2 hospitals had strikes. And that was the number one thing, is they were talking about nurse staffing. And as we understand downstate, the acuity measure is what you all use as to how much nurse ratio staffing that you have. And fortunately, your nurses downstate have seemed to understood and support that, and know that downstate hospitals have a different problem in this issue, and they understand that the acuity is the factor that you staff on, not just a random number that you have to staff so much no matter where it is. So yeah.
Correct. Thank you very much.
All right. Our next question, switching gears here. Do you have any insight about the Open Space Lands Acquisition and Development Grant?
Well, everybody's wanted open spaces here lately. So I don't know. I truly don't know. We could certainly look into it. OSHLAD grants have been around every season, but I really don't know how much was appropriated in the budget, but certainly can look into it.
If I'm not mistaken, I think that appropriation held true to the same level as last year's appropriation, but we can sure find out. And
Yeah,
Like-
we'll let you know.
If I might interject, I don't know if we're allowed to unmute.
Sure.
But yeah, it's still 29 million, but the IDNR has informed us that that funding is now on hold. It is not being released, so the application process has been just at this time, and nobody has really any answer to when it might reopen or what's being done with that appropriation.
Oh, well, thanks for letting us know. We'll try to figure out what's going on there. Also, I know since Department of Natural Resources oversees historical preservation now, they just announced some grants and possibilities out there. So, I throw that out there because we always get asked, is there any money for historic preservation? And usually there's not, but they did announce some grants in that area, but we'll certainly find out why the OSLAD grants are on hold.
And Rachel, do I understand correctly that they're not even taking applications? Is that correct?
Correct.
Okay.
They didn't really send out a notice to us either. I found it out on their website when I went to IDNR, so it seems like a lot of secrets, huh?
Shocking.
Well, thank you. I appreciate you guys looking into it.
Alrighty, our next question. Have any BOT members been approved by the Illinois Senate?
Any DOT, I'm sorry.
BOT, Board of Trustees.
Oh, well, there again, we're not in session. We probably won't take those up for review until November and December, 2 weeks. So not that I know, but that's when probably the next opportunity would be.
All right, thank you. Okay, next question. Has there been any discussion about legislation addressing tort immunity and hold harmless for agencies and governing board? I'm surprised we haven't had more lawsuits to date.
I'm going to let the attorney take that one.
There has been a lot of discussion, one with COVID and then with the police issues that have been brought to light. Because, there's something called sovereign immunity that governments and people who work for them enjoy. And only if your gross negligent activity violates any sense of decency, I suppose, would you be subject to a lawsuit within a government context. And then with the COVID, a lot of people wanted immunity in many areas, nursing homes and the like, because of not being able to contain the pandemic. So I, again, haven't seen legislation, but yes, we may. And it may be a very vigorous discussion on this in the next spring session.
I look for these discussions in the spring to be very robust, given what we've been through in the last several months and what we have looking forward. As Jill mentioned, there was some immunity given to long-term care and hospitals for a period of time, but that was recently lifted as well.
All right, thank you. Our next question, switching gears a little bit here. Why did Mcdonough County get lumped into with Rock Island, Peoria, as well as Chicago, Collier counties?
I would love to know the answer to that. We have asked that of the administration and just pretty much have been told that's how it is. And Jill and I were talking early this morning on some other issues and wondered why Adams County wasn't part of our region and why it went into the region south of us. But I can tell you at the end of the day, we're just pretty grateful that Cook County is its own region.
Yeah, I've never thought of you all as North Central, but
No, no. I couldn't find it the first time I looked for it. I thought, well, they missed McDonough County. They left us out. And then I looked at North Central and I went, well, that makes no sense.
you know, you're in with Warren and Knox and Henderson. That makes sense. And
Yep.
then it goes far, and Fulton beyond, and then it goes, I mean, you're with Grundy County. That's Morris, Illinois.
Right.
Yeah.
Thank you. Our next question is, when will the next round of recreational cannabis licenses be announced?
They got put on hold. And I know that everyone is clamoring for it to get done. So I'm not sure. I would think by the year's end.
That was actually the bouncing ball of our 3-day session in the negotiations. We'd have a caucus discussion and it was in, and then we'd go back an hour later and it was out, and then it was back in, and then it was out. And I think right now they are on hold because they quite frankly can't figure out. They've said that the next round is going to be concentrated on areas that are most challenged. And quite frankly, I think they're having trouble getting people, number one, to apply for those licenses, to be able to pay for those licenses, and to be approved. So I think that's where the challenge is. Like Jill, could be the end of the year, but I wouldn't stake my claim on it.
All right. And then we have just kind of a general question, since we are obviously, the chamber represents the business community here in town. There's just a lot of buzz, people just worried that we're going to bounce back to phase 3, which we touched on a little bit earlier. But what are some things that our business owners and leaders can do in the community? I mean, obviously there's wearing masks and keeping everything clean, and there's just a lot of uneasiness and unrest. So if you have any words of advice, we would really appreciate it.
You know, I hear often people just say, I am so over this. Well, we all are. And unfortunately, I don't think it's over with us. It's encouraging to hear them talk of vaccines. And a lot of people may not want to take a vaccine, but some do. But it's probably not going to be available till early next year. Of course, you know, the timetable has moved up greatly, and so maybe that timetable will move up as well. We've got to have it tested accurately so that we are somewhat confident that it's safe for those who choose to take it. So that being said, it is a struggle every day for a business. You know, I know everybody is operating differently and wanting it to return to normal. And I don't see a normal coming back anyway soon. I mean, it's even going into the school year has so many, and the opening of WIU, so many challenges every day. So unfortunately, I can't say that with any certainty that we're just going to be back. Now, I don't see us going back to phase 3, but I think it's going to take concerted effort to do that because of the spikes. We will just try to chart new paths and try to help everybody. When you have an issue, let us know. We'll try to work on it, because I know all these different issues arise continually. It is a trying time to be in business. It's a trying time anywhere. But like I say, the most common thing I'm told is, I'm so done with it. And I understand that. I am too. But I think we're going to have to keep vigilant and just keep trying to create new ways to do what we've done in the past. to do the same things we've done in the past, but do them more creatively and in a different manner.
And, in the beginning, when this first happened, I think all of us were caught off guard. No matter what line of work you were in, I think all of us were dumbfounded. And then the word was, well, wait till the weather gets warmer and the heat will kill this. Well, obviously the heat didn't kill it. The heat has aided to make the numbers spike, but I would say that kudos to our region and for what we've been able to do with keeping the numbers, in my opinion, I think at a pretty good level. But I think that our business persons have also been very creative throughout this. I'll start with Mcdonough County Shelter in Place and JB for what he did for restaurants was incredible, absolutely incredible. Haven't seen that anywhere else across the district. But also for our mom and pop shops, I've seen more and more the use of social media from them, and I can't help but think that has been successful for them as well. I look for that to continue, and I'm hopeful that we don't have to think about going back to phase 3 because we're smarter than that, and we are moving forward, and we can maintain this. But God forbid we would. I think that we've all learned some very valuable lessons on how we can better cope in these situations.
Thank you very much. I like how everyone's head nod when you started saying how creative our businesses are and how wonderful our region is. Everyone across the board was doing this, so it's nice to see that. We had another question come through. Any comment on the recent round of subpoenas served on Speaker Madigan?
Want to wait into Friday it is interesting. We have talked about Mike Madigan and his control of all things legislatively for years and how it's unhealthy because he has that much control over every bill that gets filed, because even in the Senate, our bill has to go to the House and he can stop it with an iron fist as he does very often. So it's just troubling. I know people in Illinois are so tired of corruption. This year has been astounding. Norine had House members. We had Senate members. I still have a Senate member sitting in the Senate that's indicted. And now this, they subpoenaed records, or the records have been asked for from Joe Barrios, the Cook County Assessor's Office, again on the governor's Gold Coast Mansion, Gibson Restaurant. Many of us have been there. Several other places in the city of Chicago because of their favorable real estate assessments. And then just today, there's a subpoena in the Thompson Center with guys going in to get records out of Madigan's office, and he's named as Public Official A, the Illinois Speaker of the House. So the corruption's got to end. And if this is it, I'm glad to see it.
I just, I'm not going to say that I'm surprised. We have known that this was ultimately what the federal investigation was about, and as the onion began to be peeled back, I think most everyone, and I would dare say the speaker himself, knew that he was at the center of the investigation. I think that ComEd and the $200 million fine is significant. It's one of the highest in this area, this district, for corruption. But I think it's also telling that that fine could have been $800 million, and it was not. And so they are certainly cooperating with this federal investigation, both with the FBI, with the Department of Treasury, and other areas of law enforcement. And it's a shame that Illinois continues to wear these black eyes. And if this is what it's going to take to finally get to the bottom of this, then so be it.
All right, well, believe it or not, that was the last question that has been submitted. I want to remind everyone, if you have any other questions, speak up now. You know, you're more than welcome to do it. We have just over 10 minutes left of Jill and Norine's time. Otherwise, I open it up to the two of you if there's anything else that you would like to add.
I would just say thank you, first of all, again, for your time, and we certainly appreciate it. There are some challenging things that we're going through in a lot of areas, but for us, I think that the bulk of our concentration has certainly been helping people navigate through unemployment issues, and while that certainly hasn't been easy, if you know of people that need help, we are certainly here to do that, and happy to help them with that or any other issue that may be coming up. So we're pretty much a captive audience, which is not necessarily a bad thing sometimes. So just happy to help if anybody needs anything.
Right. Besides the unemployment insurance issues, another one was licensing. People would see that their check was cashed and they couldn't get their dental hygienist. So if you hear of people like that, we'll certainly try to help them get those. I think the state was supposed to go back to working pretty much in-house with most of the agencies July 1. So there's a big backlog there because certainly people could work from home, but some things couldn't be addressed working from home.
All right, well, you can definitely tell it's Friday afternoon. Last time I had just a million questions flying in at the last few minutes. I think everyone's ready for the weekend. Senator Tracy, Representative Hammond, I want to thank you so much for everything you do for our region, for our city, for our county. It does not go unnoticed. We appreciate your time today, and hopefully a couple months down the road, we can chat again and get another update. This is being recorded, so I will email it out to everybody after it takes 20 hours to upload to YouTube. So once that's all done, I'll get it sent out to everyone. And I'll also include Representative Hammond's and Senator Tracy's contact info in case you have any further questions. You can always feel free to reach out to them at any time. I mean, they're wonderful. You send them an email, you hear back quickly. So
You sure try.
I'd also like to thank Scott Coker. He's my helper from the city of Macomb here today. I learned in the last call I can't do it all. You can't admit people, you can't record and do all the chatting. It was a little much, so he was kind enough to help me out here today. So thanks, Scott. All right, well, unless anyone has anything else, I think we're gonna go ahead and hang up, and I hope everyone has a wonderful weekend, and thank you again so much.
Thank you. Be safe, everybody.
Absolutely.